We always talk on the importance of treating mental health. It is so, so important, and there is an interesting treatment we're going to be talking about today. So let me introduce you to Dr. Peter Klagnaz. He's the UF Health Psychiatry, or with UF Health Psychiatry, I should say. Thank you for having me.
Thank you for asking me on.
Of course. So tell us about UF Health Psychiatry and your specialty in treating severe depression specifically.
Yeah, we developed a treatment-resistant depression clinic. This has been going on for about 18 months. We've used a various suite of alternatives to medication. One of the most common ones that we're using right now is called transcranial magnetic stimulation.
Okay, can you explain what that is and what it involves?
Transcranial magnetic stimulation uses an electromagnetic field which is aimed at a certain part of the brain, which stimulates the brain that's underactive in depression.
Interesting. And so once that's stimulated, then typically people will start to feel better?
That's right. They receive a course of 36 treatments over the course of 9 weeks, and as they accumulate the sessions, they start to feel better and better.
Amazing. So who is a good candidate for this treatment?
Any person who's 18 years and older, who has been resistant to at least 2 treatments with antidepressant medications is a candidate for this treatment.
But it also, I know it's mostly correlated here with severe depression, but it can also treat some other things too. Can you touch on that?
Yes. TMS has also been approved for OCD, obsessive compulsive disorder, smoking cessation, migraine headaches, and there's much research going on into other conditions such as post-traumatic stress disorder.
Right. If this isn't necessarily the best route for someone, there are other modalities as well too, right?
That's correct.
Can you touch on that?
Yeah. There's electroconvulsive therapy, or ECT, for really severe depression with psychosis or with catatonia. We're also using ketamine as an infusion for severe suicidal depression as well.
Yeah, we definitely need to tackle mental health head on, whether it is an OCD diagnosis, depression. I mean, this, because it can just go out of hand if you leave it untreated. So it's nice to know that there is a really unique treatment now that can be done. You said 18 months? That's it?
Yes, we've been going on for 18 months. We've treated dozens and dozens of patients.
And good outcomes?
At least 70% in our hands are achieving a full remission of symptoms.
That's amazing.
Very, it's one of the most gratifying things that I've done in 40 years of psychiatric practice.
Now, how does somebody get help with this then? Do they talk to their doctor to get referred, or do they just reach out directly to you?
They are usually referred through their physician. Usually a psychiatrist who's been treating that patient for a while and not getting them better with traditional treatments.
Okay, so ask your doctor then to look into this, because this seems like it could be a game changer for so many people.
I think it is.
Life-changing.
Yes.
Thank you so much for joining me today to tell me about it, or letting me join you.
Yeah, you're most welcome.
And if you'd like to see this interview again, you can head to our website, and that's firstcoastliving.net.